Hi everybody, I'm Bill Whittle, and thanks for joining us for this PJTV special series, Keeping Your Gold in Your Golden Years. Now, we all know that caring for a loved one during their golden years can be a challenge regardless, but this is much, much worse when they're affected by Alzheimer's or dementia. Now, in this episode, we're going to discuss your care options and provide advice on how to best care for your family members who are facing these debilitating diseases. Joining me here in the studio is Susan Howland from the California Southland chapter of the Alzheimer's Association, and also joining the panel is Dr. Kelly Victory, president of Victory Health. Thank you both for being here today. Alzheimer's is a disease that affects nearly 5.5 million Americans. It affects my mom, among other people. It's a devastating disease that can't be prevented, it can't be cured, can't even be slowed down, at least not today. So, Dr. Victory, could you please just kind of walk us through some of the explanation of what Alzheimer's is? If you look at a human brain, and we're going to in a minute, it's just horrific, isn't it? It's almost like termite or dry rot. Literally, the brain is actually eaten away.
Well, Alzheimer's is a neurodegenerative disease, which means two things. It means that it causes deterioration of neurologic function, and it's progressive. It gets worse over time. One of the easiest ways to think about Alzheimer's is really in three separate stages, although they are contiguous. The first stage is slow worsening of memory loss, primarily short-term memory. Over time, that progresses and gets worse, and we start to see personality changes, some psychological changes with the individual, and ultimately, in the third and final stages of Alzheimer's disease, the person is really debilitated from both a neurologic standpoint, a communicative standpoint, and a physical standpoint, and it is ultimately a fatal disease.
How would you be able to warn people what the difference between, let's just say, memory gets a little weaker as we all get older. That's not necessarily an indication of Alzheimer's. I know a lot of people probably worry that maybe they have Alzheimer's. As they get older, they forget things. It's not necessarily the case. What are some of the symptoms that people might be looking for that would be an indication that this isn't just kind of, oh, it slipped my mind kind of thing?
Well, it's a good question because many, many people are concerned. They forget where they put their keys and they think, oh my gosh, is this it? Am I really going to, do I have a degenerative disease like what my mother had or something of that sort? What we're looking for, Bill, is really a pattern of worsening of cognitive abilities. So it's not just that one-time forgetfulness. It's a pattern of ongoing forgetfulness. It starts generally, as I said, with short-term memory, and then also spatial navigation skills start to fall. So what you'll find is that somebody all of a sudden becomes confused about something that was otherwise a routine activity, going to the grocery store, finding their way, navigating their way to their grandchild's preschool. Something that was relatively simple and something they've done for many, many years all of a sudden becomes difficult. So it's really looking for a pattern of decreasing cognitive ability.
Susan, you deal with this so many times, so many different cases. Would you say there's kind of a, onto the same sort of question, would you say there's kind of a standout sort of a symptom or a series of events that would lead you to be alarmed?
I think it's really a challenging question because Alzheimer's disease doesn't present suddenly. It's a very gradual onset. So usually you hear people say, well, it was the summer of 2005, he got lost going to the dentist. And a couple months later, he bounced a couple of checks. So there's never one defining moment in which someone says it's Alzheimer's or it's not. It's these little tiny insidious hints that are dropped over years before the symptoms are fully expressed.
I know, speaking for my own mother, I began to realize we were in real serious trouble when, it'd be one thing if it's like, well, where are we going for lunch? And I would tell her, but when they would ask the same question within 20 minutes, 30 minutes, and ask it repeatedly, you're well on your way, I'm sorry to say. Let's take a look at our next graphic. I think it'll give us some insight into this. Here we have two different images of the brain. This is a graphic of what a cross-section of the brain looks like. Obviously, on the left, you have a healthy brain, while the right brain has been affected by Alzheimer's. It's actually brain tissue is disappearing as a result of this disease. Dr. Victory, can you tell us a little bit about what's going on here? I believe Alzheimer's biological attack is related to the bovine spongiform mad cow disease, where actual brain tissue is being it's just disappearing. I guess it's being re-ingested into the body. But it's not a question of like, gee, we're forgetting things. It's not a psychological problem. Actual neurons are disappearing.
Well, although we don't, despite all the research that's been done, Bill, we do not know what causes Alzheimer's disease. There are some theories. We know that there's clearly some genetic component to it. We know that there may be some dietary considerations, repeated brain injuries, but we don't know the exact cause. What we do know is that there are some very clear-cut physical and physiologic signs that happen within the brains of people who have Alzheimer's disease. And as you pointed out, there is shrinkage of certain areas of the brain with corresponding increase in the size of those areas of the brain that we call the ventricles. The area of the brain that seems to shrink, where we have a clear loss of brain matter, is an area called the hippocampus, which interestingly is that area of the brain that is associated with moving memories from short-term memory to long-term memory, and also with spatial navigation. So those two things I mentioned earlier about first decrease in the ability to remember things in the short term and ultimately also in spatial navigation abilities, that area of the brain seems to shrink. And we also know that there is the laying down of some what we call plaques or tangles of neurons within the brain that actually causes the electrical highways, if you think of it, the way that the brain normally communicates from one area to the other, to become congested and conflicted and tangled up.
Yeah, we'll get a little more into the details of how this actually operates, this disease. Susan, we had an Academy Award film this year called Still Alice. And Julianne Moore won an Academy Award for a portrayal with a person who had early onset Alzheimer's. Generally, this disease strikes us a little bit later in life. It's not necessarily the case, right? It can happen relatively early in your 40s or 50s. Absolutely.
And we see one of the challenges is a lot of people don't recognize the signs and symptoms of that of being Alzheimer's because it is assumed to be an old person's disease. So frequently, those are individuals who don't get diagnosed in a timely manner. And do you find that since there seems to be very little actually effective treatment options, that people are a little reluctant to go in and get tested to find out that they have this? Isn't it true that even though there may not be a great deal we can do about it medically, having an early diagnosis certainly helps us prepare for things financially in terms of the family setup and so on? Absolutely. We strongly encourage an early diagnosis just for all of those reasons, and it helps people plan. However, we do find the medical profession is less likely to give someone a diagnosis of Alzheimer's disease and tell them of that diagnosis than, say, other diseases such as cancer or diabetes. Well, Alzheimer's is a tricky disease in that it can occur at various points in a person's life. Now, this can range, as we said, from early Alzheimer's, which can appear as early as 20 years old, or prior to a diagnosis anyway, rather, to severe Alzheimer's, which usually occurs later in life. So, Dr. Victory, what are the warning signs, and how can someone tell if they're susceptible to early onset Alzheimer's?
Well, early onset Alzheimer's is relatively rare, thank goodness. There's no question that your greatest risk factor for developing Alzheimer's disease is aging. In fact, the risk of developing the disease doubles for every 5 years after the age of 65. So between 65 and 85, the risk doubles every 5 years. There is a relatively rare genetic mutation that can cause the onset of very early Alzheimer's disease, sometimes as early as age 20, but that only accounts for about 1 to 2% of all the cases of Alzheimer's disease. Again, there is clearly a genetic predisposition to it, and so if you had a parent or a number of relatives who had Alzheimer's, there is no question that there is a genetic component to it. We don't understand it well. There is a genetic test that can be done that gives you an idea if you carry or have the carrier for early onset Alzheimer's. But again, even if you have that, it doesn't mean 100% that you're going to get Alzheimer's. And if you don't have that, it doesn't mean that you won't develop it. So the genetic testing is really quite uncertain at this point. So it's really, as Susan said, about looking for those early onset signs and not being afraid to address it with your loved one and your healthcare practitioner to say, I have some concerns about this. I'm trying to sort out, is this element of memory loss? Is this element of cognitive decline normal? Is it part of normal aging? Or is it perhaps something that we should be concerned that there is actually a diagnosis of Alzheimer's here, and let's call it what it is so that we can start initiating medication treatment and get our ducks in a row to think about the long-term care implications.
Susan, there's obviously a genetic component to this, but I think obviously you can make a fairly compelling case, at least anecdotally, that the amount of mental stimulation you get has a factor to play. My mother has a pretty severe case of Alzheimer's at this point. Her brother is 1 year younger. He is an engineer. He goes around the world lecturing 23-year-olds on jet engines, and he has so much information in his head. He literally can pull operating temperatures from a certain jet engine built in 1960 and list all of them. He exercises his brain to a great degree pretty much every day. My mother was rather isolated, didn't have a lot of interactions. Does that social, psychological impact have effect downstream as this disease gets worse?
There are thoughts, not a lot of research that supports that people who are mentally active during the course of their lifetime have maybe a slightly less likely chance of developing Alzheimer's or some sort of memory and thinking. But again, it's a combination of physical exercise, kind of cognitive stimulation, social engagement, as well as diet, probably are some of the other areas you'd want to look at as well.
Just one last thing on this early testing. Are there, would this be a MRI, a PET scan, a CAT scan? In other words, if you were just somewhat concerned, let's say you weren't showing any symptoms whatsoever, how early can symptoms be detected? How much of a head start can you get, Dr. Victory?
I don't think that there's any recommendation for doing early PET scanning or MRI scanning of the brain. By the time somebody has those symptoms, the symptoms are well enough advanced, that's when you begin to see those obvious signs on radiographic studies. So at this point, I would not suggest that people go out as random screening for the disease by getting some sort of a test like an MRI or a PET scan.
Well, Alzheimer's and dementia are often used interchangeably when in fact these are two completely separate diseases. We can ask about what the clinical difference is between these two diseases. I don't want to give too much information here, but Alzheimer's is sad and heartbreaking, but dementia rips your spine right out of your body and just throws you in the trash heap. It's unbearable. It's unbearable to see what the dementia does to people. Kelly, you do so much work with people. Alzheimer's gets a great deal of the publicity. I suspect it's because the dementia is so much uglier in so many ways. Dementia can be absolutely emotionally devastating to the people closest to the person with that disease. Can you give us a couple ideas of what some of these symptoms can manifest themselves as?
Just individuals with dementia really just suffer, memory and information processing and just overall decline in function. And because of the damage to the brain, there are a lot of what we would call behaviors that are kind of expressions of this dementia: hallucinations, getting lost, not recognizing a spouse, children. As much as these symptoms are difficult for the person with dementia or Alzheimer's disease, it tends to be even more difficult for those caregivers as well that are providing care for someone they've lived with for 60 years but no longer receive that thank you or recognition of who they are.
That's kind of it, I think, isn't it, Kelly? It's not just a question of, gee, I don't recognize you or I don't remember you, but in cases of dementia, they can be treated as hostile personality specters from their past. Maybe they had a horrible situation when they were teenagers, and now that person, the caregiver 50, 60, 70 years later, assumes the role of that person. There's a lot of lashing out, a lot of emotional trauma. It's horrific.
Absolutely. And just to clarify a little bit, Bill, dementia is the more generic term for cognitive decline. Alzheimer's is one form of dementia. It represents about 60 to 80% of all cases of dementia are caused by Alzheimer's disease. The other forms of dementia, many of them are actually reversible. Many of them are related to biological things, chemical things going on within the body. There are lots of things, other things that can cause dementia that actually might be reversible. Unfortunately, Alzheimer's, the 60 to 80%, is not reversible. And as you said, the issue with the dementia is it's not just that short-term and then long-term memory loss. It's the fact that there are actually psychological and emotional changes that happen. People typically become aggressive, or they can have episodes of aggression, sometimes related to frustration. There are changes along the way that go beyond simply being forgetful, and that's what makes it, I think, extraordinarily difficult for caretakers, because you're not dealing with somebody who is any longer rational.
Yeah.
They have episodes where there's no convincing them that something is not occurring. People can become quite paranoid, quite agitated, and managing those people 24/7 can become a real challenge.
Well, Susan, we talked earlier about some of the warning signs for Alzheimer's. No matter what age the onset occurs, what kind of things would be a red flag indication to you for the early precursor symptoms of somebody who's developing dementia? What kind of things would we want to look out for if we saw it more than 1 or 2 times?
Clearly, it's going to the physician, talking to an individual, what's going on, having an individual keep a log. You know, today I was in the middle of a joke and I forgot the punchline and I didn't ever remember it. So having individuals keep a log, family members contributing to that, so that can be presented to a physician, and then the physician does a pretty thorough diagnostic workup that includes, psychological, maybe some scans, a physical lab work to try to rule out all of these other reversible possibilities.
What would you see in a parent, let's say, that would, so everything's fine and everybody's getting older, everything's fine. What kind of sort of early onset behaviors for dementia would you say are fairly common that might want to make a family member actually start to get involved with this?
Most people report it's that short-term memory. So starting also to have problems with activities that were so routine. So someone who's always kept the budget for the household might start bouncing checks, or not forgetting to pay the gas bill, but paying the gas bill 4 times. So typical behavior that's very atypical of that individual, especially in overlearned behaviors.
Fantastic.
Sometimes we'll also see changes in people's appearance. People who are otherwise well coiffed, well put together, all of a sudden you'll find that they're wearing clothes that are clearly not clean, have not been laundered appropriately. They're putting things together that don't match, that they would otherwise not wear together. They look more disheveled. Their ability to apply things like makeup or do their hair when somebody was normally very well put together, and all of a sudden those things are starting to decline. They're not taking care of themselves, or the house, you'll come over and all of a sudden there are dirty dishes in the sink or plates left on the table, laundry that isn't done, those sorts of things, mail that isn't opened, bills that haven't been paid, those sorts of things are all real red flags.
Departures from routine, simple things.
Right.
Exactly.
And I also have to add, a lot of those behaviors can also be, the individual can compensate. Well, I'm just going to let the mail pile up and go through it on Saturday. So frequently we assume it might be something else, and we hope it's something else. So I think there's frequently a level of denial by the family.
I was just going to say, denial's our big enemy here.
And ability to compensate by
Absolutely.
the individual in those early stage.
Well, as Alzheimer's and dementia begin to take their toll, certain changes must be made to the patient's environment. Normal day-to-day activities that were once safe and mundane take on an entirely new risk. For example, cooking food's no longer an easy or a safe task, but it's a fire hazard waiting to happen. So just using cooking and food as an example, before we get into full-on medical care, what are some of the sort of intermediate steps that we can do to take additional care of people that are showing symptoms of this disease? Obviously, as it gets progressive and gets worse and worse and worse, we have to increase the amount of care. But in the early stages, what are some of the simple things that we can do, Kelly, to kind of safeguard our loved ones who are starting to grapple with some of these symptoms?
Well, I think the biggest issue is being willing to have that conversation. And that's the toughest part. People are afraid to say it. They're afraid to actually say, look, Mom, I'm a little bit concerned. I'm concerned about your safety. I'm concerned about some things that are happening, and let's put in some changes. So I think the first thing you can do is start to leverage family and friends to begin to have a closer look at that person. If somebody's living on their own, then you need to have a closer eye on that person on a daily basis. So it may begin with just more frequent visits, or asking your loved one, are you willing to allow somebody else to come into the home once or twice a day or several times a week to check, just to give you some extra help around the house, Mom? I'm concerned about that. So it's really, I think, about getting more eyes on the situation first so you can get a better understanding and really analyze, is there a true risk here? Because as Susan said, these things don't tend to go from 0 to 100 overnight.
Susan, on the same point of that initial conversation, because that's really what starts the process, it seems to me that if you're starting to get a little worried about a parent, chances are they were themselves worried before you caught on, right? Surely, in many cases, it's got to be something of a relief for somebody who's beginning to experience some symptoms, for somebody else to step up and say, hey, I noticed this, do we need to have a talk about that?
I think everyone has a different response. Some people do find relief in either labeling, or having a family also kind of identify and confirming some of their concerns, as well as maybe even a label for some of the issues that they're having. Other people might not actually have insight that they're having difficulty. If this is an individual that's having some short-term memory problems, they might not remember that they've asked you that same question 10 times in the last 15 minutes. And because they don't have that awareness, they will disagree with you. I don't have a memory problem. I don't keep asking you the same question. So it really depends on the individual and their level level of acceptance.
Well, to help make this a little more concrete and a little more something perhaps a little workflowy, something that people can actually use more practically, we put together a brief list of some potential home safety things that we can do to help with people who might be experiencing the onset of some of these symptoms. So let's have a look at this graph that we created. For example, you can create a safe and functional environment at home. We'll come back to all these, just take a quick look at them, and then we'll come back and deal with them one by one. Clearing walkways and preparing for walkers and wheelchairs. You can secure appliances, doors, and medicine cabinets. You can use locks to control access to high-risk areas like maybe cleaning areas or cleaning fluids and so on. And you can allow natural light into this space to help sundowner syndrome. We'll come back to sundowner syndrome, certainly. Let's just talk about some of these things. A safe and functional environment, I think that pretty much is, we can take that as read. But there's something interesting about clearing walkways and preparing for walkers and wheelchairs. You can stay ahead of the curve on this, can't you, Kelly? You can either get behind the curve or ahead of it. You can start anticipating that this is going to be a problem. It makes the transition a good deal smoother, doesn't it?
Absolutely. And I cannot state enough how important it is to look at those walkways, staircases, rugs, things that people will trip. There's nothing, a broken hip will change the trajectory of the entire medical care for that person. So removing things like loose throw rugs from in front of a sink. Increasing the lighting. As people age, their vision already starts to decrease. People with Alzheimer's get more confused and are likely to be up at night walking more than other people are. So increasing the ambient lighting around the house, not just with little night lights, but really putting in some brighter lights in hallways and in bathrooms, things like that can really help.
Susan, do you think there's anything on that list that we might have missed? There's anything that you run into that is a repeated problem that maybe people should be looking out for?
I think not one specific area. It's looking at an individual and where they're having some problems and where they're not, and adjusting the environment to support that individual in their independence, as well as kind of safeguarding some potential accidents. Bathrooms are always important places to look. Kitchens as well. Judgment might change, not understanding the passage of time. So food might be left on the stove for a long period of time. So again, having those additional eyes in the house, as well as making some simple and fairly inexpensive changes, really help maximize independence. Simple
things like kind of high friction strips at the bottom of a bathtub because people's balance tends to degrade over time and falls out of the bathtub are significant course of these injuries, I guess.
And even something as simple as an automatic turn off on a toaster oven.
There you go. This is the appliance thing and so on. Yeah, great. Well, another key element to successfully caring for a loved one who suffers from these diseases is a daily schedule. Schedules are important, and they help prevent sundowning effect. Sundowner syndrome is horrific. The short form is that many people begin to panic. It seems to be mostly women, I think, generally speaking. At least it appears to be from some of our perspectives. But with the onset of sundown, as the sun begins to go down, many patients with Alzheimer's and dementia begin to feel a sense of increased memory loss. There's confusion, agitation, a great deal of anxiety, I've noticed, a great deal of sense that something bad is about to happen. We're going to enter the evening, and this set of symptoms is unique enough to have a name, sundowner syndrome. Dr. Victory, can you tell us a little bit about what these things come together as and what are some of the challenges of dealing with them?
Absolutely. Sundowning is not a disease in and of itself. As you said, it's a set of symptoms that happens across the spectrum of different things that cause dementia, certainly very, very common amongst patients who have Alzheimer's disease. It's a phenomenon where late in the day, for some reason, it's not well understood, late in the day, people tend to get more agitated, more confused, and more upset about small changes in their routines. We believe that's probably related to some disruption of the normal circadian rhythm, that thing that allows us to modulate our behavior and our sleep-wake cycles. So in the same way that a baby, that small infants will sometimes get their days and nights turned around and get confused and be awake during the night and sleeping during the day, the same thing can happen with people who have dementia and certainly Alzheimer's disease. So we know that as the day gets later, people who are otherwise doing relatively well during the early part of the day all of a sudden will start to have worsening of their symptoms, agitation, confusion, a lot of fear, a lot of anxiety, and sometimes some behavioral changes that go along with that, where they become more combative, are unwilling to listen to reason about certain things, and it can be very, very disruptive for themselves and for the caregivers.
Susan, does this does sundowner syndrome last throughout the course of the evening? Does it tend to abate a little bit once things begin to establish themselves in a nighttime ritual? And especially, what can family members do to help alleviate, especially the fear, because that seems to be the most difficult part to deal with?
So as with, you've met one person with Alzheimer's and you've met just one person with Alzheimer's. So it's going to be very different in each individual. Mm-hmm. Some people joke and say, my husband's sundowning starts at 2 p.m. The sun is still up. So again, it's really going to differ, but it's really, again, getting ahead of the curve. Is this individual starting to get just really exhausted physically and mentally from trying to keep up the whole day? Are they agitated because there's really a lot of activity at home? People are coming home from work, maybe caregivers are leaving, dinner's being prepared. Can I move him into a room that's nice and quiet? Can I engage him in an activity before he usually starts becoming upset and sundowning? Can we go for a walk ahead of time if he has a little bit of extra energy that needs to burn off? Can we go for a walk to try to kind of calm that down? Can we not have a big, huge dinner? Can we have our large dinner at lunch and just have a very simple snack at this time? So there are ways and strategies that caregivers can try to get ahead of the curve, and always working with a physician to see if there are other things that are possible, such as other pharmacological interventions.
Kelly, since short-term memory generally goes before the long-term memory, it occasionally seems, at least in my limited experience, that dealing with somebody who's maybe experiencing some of these anxiety symptoms, sometimes talking about old memories, talking about old times puts them in a comfortable place. It reestablishes them in their framework of their family, and that part of their memory is a little more intact. And rather than going to this place of sort of unfocused anxiety, it tends to ground them a little more in the memories that are still a little more consistent than maybe some of the short-term memories. Is that a coping solution that you find works?
Absolutely, and sometimes music plays into that very, very well. Music that they remember from their childhood, from their earlier, from happier times. Mm-hmm. So putting on music, I know when my father was dying of an Alzheimer's-related disease, that putting on music was very calming to him at that time of day when he would normally become agitated. And I think that works for a lot of people. Same thing, there's sometimes a television show or something that's reminiscent to them of a time where they can feel very settled, very secure, and that anxiety will abate. Doing your best to not change up the routine. Routines are extraordinarily important to people who have dementia and certainly Alzheimer's disease. In the same way that they are to an infant, routine and staying with that routine is extraordinarily important. Another thing that will help is making sure that people aren't bored and napping during the day. As you can imagine, if somebody's spending a lot of their day sitting in a lazy boy chair, napping, falling asleep,
they're going to be up all night.
Exactly. It's hard to expect that person then to have their circadian rhythms tell them it's time to settle, it's time to calm, it's time to get into our evening mode. So making sure that they're not spending inordinate amounts of the day. Naps should really be capped at 15, 20 minutes at most during the day if you really want that person to be able to settle during the evening.
Well, while there's no actual medical treatment that seems to have a tremendous effect on Alzheimer's, there certainly are supplements and vitamins, things such as Miriam EHT, that may be able to combat at least some of the effects of Alzheimer's. Susan, do you find that any of these things actually help? They may not stop the disease. They may not even slow it down. But perhaps they mitigate some of the symptoms. What's been your experience with some of these supplements? Again,
it's probably an individual basis. As the Alzheimer's Association, we typically encourage families to work very closely with their physician because we do want to be aware that any sort of over-the-counter product, vitamin or herbal supplement may or may not have impact with other health conditions as well as other prescription medication that's being given.
Well, I think, it's important to remember that it's not just the patients, right? It's not just the patients that suffer with Alzheimer's. I think perhaps more than any other disease, this has a wide circle of influence. The horrible part of this disease is that it destroys the essential part of the person while the physical body stays there, as opposed to most other diseases that may destroy the person's body, but at least the essence of who they are remains to the very end. And that's very, very hard to cope with families. Certainly people are living longer, and they're retiring and living 20, 30, 40 years longer or after retirement rather than that. So as we get longer lived, we're seeing more and more and more of these cases. People are just finally living long enough to get Alzheimer's. They've been killed by cancers or heart disease or whatever earlier. So what can we do for the families? Are there support groups? Susan, I'll come back to you on this one. Obviously, there must be some kind of support group systems. What would you do if you are beginning to experience this in a loved one and feeling already that you may be beginning to get to the end of your rope?
And that's really pretty common for most family members who are providing care. And I think it's recognizing early on, how do I link into programs and services? It's really hard for a lot of family members to say, you know what, I need some help. This is really a challenge for me because this is my husband. How can I suddenly say, he's driving me nuts? So having individuals link into support groups, and there are plenty of them in person, on phone, over the internet, just to be able to share these experiences and kind of share these emotions. It's also being willing to accept help. How many times has a neighbor said, well, let me know if I can do anything? And typically we say, well, thank you. Well, can you come over and help me with X, Y, Z? So it's be able to say, yes, I need some help with a program. I think this service really would enhance. It's also making sure I take care of myself, because we do see the caregiver frequently passing away before the individual with dementia, and which makes it even a more trying and devastating disease.
Kelly, one of the problems with a disease like this that affects the mind is that it screws up our cues. For example, if you were trying to take care of a loved one at home, a parent, let's say, and that person had cancer, you would do as much as you could to help them and make their life as comfortable as possible, but it would become immediately obvious to you at some point that now it is time to take this person to a hospital because they are now in end stages of this disease. But with Alzheimer's, their body's often perfectly fine. And so it seems to me that with Alzheimer's, people are much more reluctant to say, this is the point at which I cannot do this anymore. It's not a question I don't want to. The demands of this disease are now so great that it's time to get institutionalized care. What does that look like towards the final stages of Alzheimer's? What happens to a person when they get to that point? And at what point would you say it is now time for you no longer to be able to assist them with living, it's time for them to get institutionalized care?
Well, you're absolutely right. It's very difficult because the physical body tends to stay intact far longer than the mental component does, than the cognitive component does. Ultimately, Alzheimer's does result in tremendous debilitation of the physical form as well, and people become entirely dependent for things like using the bathroom and showering and bathing and eating and those sorts of things. So then it's pretty clear. But the point that you're making is that gray point in between where the person is just unmanageable at home. What we find with Alzheimer's and all forms of dementia is there's a tremendous amount of guilt on the part of caretakers, and they are afraid to say, I can't do this any longer on my own. I need help. This person is at risk, and I simply don't have the ability to do this 24/7. So on one hand, if you can either rely on family, friends, support groups to get some additional assistance at home, that's one thing. But once you can't, and you feel that your own health as a caretaker is starting to suffer, and the well-being of that individual, I think it becomes pretty clear at some point, we can no longer do this together, and it's not a good situation for either the patient or the caretaker. There are lots of options at that point, really, but it's about getting over that guilt and saying, I am not doing a service to my loved one by trying to keep him or her at home, because we are a pending disaster. This is a disaster waiting to happen.
Let's talk a little bit about the cost on the family members and the caregivers, because unlike a disease like cancer or heart failure or emphysema or something like that, where the person's body withers away, the symptoms, the emotional devastation extends out to the family. They don't recognize you anymore. They don't know who you are. This is a person you've spent your entire life with, might be your mother or your father. Not only sometimes do they not recognize you, perhaps they'll start cursing at you using language you've never heard before. It's horrific. So caregivers can also experience varying stages of grief and loss. These feelings can range from denial that the person's actually ill, to anger over presenting the demands of caregiving, to grief over the result of all of these things. Guilt is another feeling, as we heard, that many caregivers have to deal with. Now, oftentimes caregivers find themselves so overwhelmed that they end up wishing the patient would just die. Just admitting that that's true is probably the single hardest thing about this, is just coming to the grief where you realize this person doesn't know who I am, they don't recognize me, they're swearing at me in language I've never heard before, and they look like they're going to live forever. It becomes emotionally unbearable. So Susan, what advice would you give to caregivers so they don't collapse under the weight of this emotional trauma with a person who, in many cases, has, for all intents and purposes, died and then continues to live for another 10, 20 years?
I think it's really important for caregivers to acknowledge all of those emotions, because there is a huge range of emotions that are conflicting and occur at the same time. You know, I love my husband, but I want him to die and I hate this disease. So it's really being able to have those caregivers acknowledge those emotions to be able to process that information. A lot of times this is a disease, again, that can last up to 20 years. So these emotions are building, the grief builds over a long period of time, and frequently caregivers aren't recognizing how much stress and how much toll it's actually taking on them. It's also really important for individuals to, again, link into other supportive services. It's also important for caregivers to recognize that I have control over this situation. I can make decisions rather than having this situation and this disease control me. So kind of shifting that control helps to empower caregivers as well. And just really giving them education about what their options are. A lot of times people don't pursue institutional care because they don't know what it is. They think it's the nursing home that they visited their grandmother back in the 60s. So it's really giving caregivers education to understand what is going to happen, what might happen, and what are all the different options that they have, you know, to choose from. And it's really remarkable that there are a range of options that there are in this day and age.
Kelly, on the point of grief and, you know, the sense of responsibility, from the beginning to the end of this disease, the caregivers can say, look, that's the disease talking, or that's the disease, it's the disease, it's not our mom, it's not our dad. But simple things like just showing somebody a picture of what the brain looks like before and after does an awful lot to alleviate not only the personal guilt, but it unburdens the person of the responsibility. When you see a brain in late-stage Alzheimer's and see just the physical damage that's going on, it helps emotionally quite a bit, doesn't it?
Absolutely. And there's no question that we understand from a physical perspective things like cancer and heart attacks.
Symptoms are on the outside.
Exactly. They're on the outside, and we understand that that organ is failing. We have a harder time understanding when that organ happens to be the brain, and it's the very essence of who we are as individuals. When it's your personality that is being degraded rather than your spleen or your liver or your heart muscle, that's very, very hard for people. So I do think that showing them those pictures, helping people to understand that the brain is an organ like any other, and it is degraded, and it has gone away, and your loved one's personality has gone and changed with it. And you don't need to carry that guilt in the same way that you would avail yourself of additional care or long-term care or another facility. If your loved one were dying of cancer or another disease, you would do that same thing. It just is very difficult, and I think what we can do as caregivers, as physicians, as healthcare practitioners, is to give people those tools to understand the disease, to cope with it, to not carry that guilt, to avail themselves of other services and support groups so that this disease, it's not going away. And as you said, we are an aging population, so we're going to see more and more and more people, unfortunately, with late-stage Alzheimer's disease and other forms of dementia. And so we need to be able to provide services for those people who are left at home.
That's what makes this disease so horrible for the family, right? Because with any other terminal disease, it's a two-way emotional bond that goes to the last day. It's the caregiver and the patient. But in the case of Alzheimer's, that patient bond falls off, and it's pretty much a one-way street.
That's right.
Yeah. Well, lastly, let's take a look at how to avoid some common financial pitfalls that are often involved in the case of a patient with Alzheimer's or dementia. Now, with proper planning, many of these can be more easily managed and help reduce the caregiver's stress, which is already pretty high. It's also important to make sure that you have access to several important financial documents. Knowing where these essential documents are located is critical. It's absolutely essential so that you can best care for the patient. Now, do you find that this financial preparation is one of the things that people are most unprepared for, Susan? Do you think this is an aspect of it that comes to them last?
I think, it depends. So probably a spousal couple probably have prepared a lot of these documents, or maybe understand and have discussed kind of expectations of legal and financial. It's when it's an adult child caring for a parent that seems to be kind of the disconnect. You know, my dad has always been in charge of his finances. He's always been very independent. I don't want to intrude. But again, it's important to have that conversation early. You know, where are these documents? Who has these documents? Who needs to have these documents? And it can be spaced out over time. You know, every week we'll tackle one more topic, but it's important that everyone who needs to have that information has that information. And even in the earlier stages, individuals can still make financial plans, can still make legal plans, can express their desires for the future as well, which really underscores the importance of addressing these symptoms and getting a diagnosis earlier than later.
Just to follow up with you on this, Susan, as patients begin to lose abilities and as their outlying abilities begin to collapse, don't you find that often the control of the finances is the last thing they kind of like often will just bitterly cling to, like this one area is something that they're going to hang on to the bitter end to maintain their identity?
Many people do. They have to have their checkbook, they have to have a pocket of cash, they store their purses in very clever hiding places so no one can get their money. Also, we hear a lot of cases of individuals will misplace their wallet and then accuse others of stealing that money. So it does seem to be this one area that's a pretty common issue for many families.
And perhaps you can set up an account with a limited amount of money in it that they can have access to, so there's only so much damage they can do to them, to themselves.
And alert the bank. I mean, there are a lot of safeguards you can put in place.
Well, another key document, of course, is power of attorney, because once we begin to have people who lose their mental facilities, power of attorney becomes a very important thing to have. Power of attorney documents allow a caregiver to handle a variety of issues that may arise, and we'll discuss this critical document later in our series to make sure you stay tuned to the upcoming episodes. I'd like to thank our panel very much for sharing their expertise on this very dangerous, very deadly, emotional subject. It's just absolutely debilitating. Susan Howland from the Alzheimer's Association, Dr. Kelly Victory from Victory Health, thank you so much for being with us here today and giving some real insight into a really dark place.
Thank you.
Now, for more information on Alzheimer's, you can visit alz.org. And coming up in part 3 of this special series, Assisted Living, Nursing Homes, and In-Home Care. You can learn which is best for your loved one in our next episode. Until then, I'm Bill Whittle, and thanks for watching.